Existing law stipulated that every child born must be registered in the civil registry within 30 days, and it should be done from the sector's office. Some of the new parents we met in the hospital are now happy that child registration is going to be done from the health facilities where babies are born from, as per the new ministerial order. We used to go to the sector to register, but it was challenging. But because it was mandatory, we would do it. After being discharged, I would have to go to the sector, even when still weak. But now, if registration and everything is done here at the hospital, it will be a relief for me. I'll go home and rest, knowing my child is registered. We welcome this because you leave the hospital with everything sorted. Many people would take long without registering their children. There would be parents that had 10-year-old children and beyond who weren't in the registry. One of the male midwives we met at Muhima Hospital, Innocent Ndutiyimana, also confirmed that once the new directive comes into place, it will make work easier. Once the registrar is in the hospital, the parent will register their baby right there and on time without spending time to go to the sector. And it will help us too in completing our registers too. If a mother comes to give birth and they have the child's name, it will be easier, unlike before where she would give birth and then come back to bring the child's name for them to get the birth certificate. But now they will leave the hospital when everything is done, which simplifies everything for the parents and us as well. Although the hospitals record children born as well as staff from the statistics office present at the hospital to register these children for the sector's records, parents would still go ahead to re-register their children for them to get civil status documents. The Minister for Local Government, Professor Shaka Anastas, explains that the new ministerial order will give authority to the selected individual over the registry of civil status of newborn babies. The good news is that where the baby is born is where they'll be registered from, and it will be done electronically, such that when the mom is discharged, they won't have to go to the sector. The same goes for the deaths registered in hospitals. All government hospitals and health centers have been prepared in a bid to simplify access to quick services. So far, over 90% of children are born in hospitals, meaning that they will all go to the civil status registry right away. The Ministry of Local Government explains that for babies who are not born in the hospital, the President's order gives the cell's executive secretary the powers of registering them without going to the sector.